Again, research that's out there right now is obviously talking about the sort of FROST trial. This is very interesting because it was obviously looking at different things. Obviously, this trial did not include any hydrodilatation, but it's really important to see the fact that you were had early structured physio, mobilizing techniques, a gradual home-based program, and then obviously a steroid injection. And um, you know, they found that actually a lot of this um, research was we've tried all different things and they've tried everything. And this was a really good paper. I think it came out in was it last year sometime?
Yeah, so Rich, this came out in November
Mm.
2020, so it's only in the last 3 months. It was in the Lancet. It's a British trial. It's the biggest trial of its kind produced anywhere in the world. And what they had is they had three arms. They had people who had physiotherapy, but a lot of those patients who had physiotherapy also had a steroid injection. Then some patients who had surgery, either in the form of an MUA or an arthroscopic capsular release. And what they looked at was various parameters, mainly the Oxford Shoulder Score. And what they found at 12 months was there's no difference in the three groups. The capsular release obviously was the most expensive and had some complications associated with it. But I think one of the things is you may not have had enough numbers in there. So there was a trend that the people who had surgery would potentially get better quicker. But sometimes with these trials, you don't have sufficient numbers to prove that. But the overall take-home message was there's no difference between the three groups. But like you said, it didn't include a hydrodilatation in this because when they initially set out to do the trial, you do your preliminary work, and at that point, when they'd surveyed shoulder surgeons and said, what methods do you use to treat frozen shoulders? And most people said they use physiotherapy, MUA, or capsular release, and that's why the trial was based on these three. But then hydrodilatation became more popular, but they couldn't then have a fourth arm to this. So there are trials going on at the moment looking at hydrodilatations, whether that helps.
Yeah,
I think super importantly as well, all three arms of the study all included physio as well, whether it's early structured physio, but then also post-operative as well. So just showing how important that effective management is there as well.